Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Raloxifene. Raloxifene is also an selective estrogen receptor modulator. Raloxifene acts as antagonist on the breast and it is used as prophylaxis of breast carcinoma. Raloxifene acts as antagonist in the vagina and causes vaginal dryness. Raloxifene acts as agonist on the bones and it is used in the management of osteoporosis. Raloxifene is used as an agonist of estrogen on the lipids and thus it causes cardioprotective effect. Raloxifene has no genitourinary effect and thus it has no ovulation induction and it has no risk of endometrial carcinoma. The side effects of raloxifene is hot flushes. Selective estrogen receptor modulators are not used in the management of hot flushes.
thank you and thank you for watching.